welcome everyone. And of course, we're celebrating Sickle Cell Awareness Month. And even that in and of itself is an advancement. If we go back a while, there was no such thing happening. So right from the beginning, kudos to all of you and many others who have done things just to bring awareness and to make things such as today possible and happen. And then of course the greatest shout out that I want to start with is to TOVA, of course, and to Dr. Nina Anderson. Let's just give her. It does take a village, but I tell you've got to have a chief, you've got to have a leader, you have to have someone that's committed and willing to sacrifice, and that's why we're here today. I just want to say to you, this is a day of great accomplishment. This is a day where we're going to hear a testimony of victory. This is a day when we have an opportunity to make a greater commitment to what we can do to help those who are coming behind us. You know, there's some famous words that say, "Stony the road we've trod," and you know we've got a long, long road ahead of us. But let's do it in unity. Let's do it in faith, and let's do it in love. So, I am going to introduce this morning, Miss Sherry Reed, who is the Patient Community Coordinator. I'm going to ask her to come at this time and share with you.
Thank you so much. Can everyone hear me?
Yes.
All right. Thank you. So first and foremost, thank you to Dr. Nina and the TOVA healthcare team here for having me here today. I'm Sherry Reed. I'm part of the BPACE team, which stands for Patient and Community Educator, and I'm with Bluebird Bio, and I cover the Northeast area. And you're probably wondering, who the heck is Bluebird Bio? Never heard of them, right? Well, Bluebird Bio is a biotech company, and we're dedicated to developing gene therapy. In fact, we are leaders in gene therapy. We've been leaders in gene therapy for over a decade, and that's led to 3 FDA approvals across 3 different genetic diseases, including sickle cell, right? So to the previous speaker's point, you know, it is a wonderful day here for sickle cell as we celebrate Sickle Cell Awareness Month. And I would be remiss if we didn't thank the brave warriors who participated in our clinical trials. So can we give them a big round of applause? We are incredibly grateful for their bravery and their efforts. So the other question you all probably have is, what is gene therapy, right? So gene therapy is an approach that uses genetic material to essentially change the course of your disorder or disease. There's 2 types. There's gene addition and there's gene editing. And in both types, your stem cells are collected. And if you want to think about that, you're your own donor. That's huge. That is huge. You are your own donor, right? Your cells are modified and reintroduced to your body, and that essentially provides new instructions for your hemoglobin to your cells. So a few important considerations, right? It's a detailed process, and it takes place over time with lots to consider with your family, your care team, your healthcare provider. In short, it's a conversation, right? It's possibly many conversations. But here's what you can do. Number 1, work with your healthcare provider to evaluate, your risk and benefits specifically for you. Number 2, stay informed and have as many conversations as you possibly can regarding, your specific needs on this journey. And number 3, while you're here today, I have a table there in the back. Come back, say hello. Right? I'm here to share information and to help you on your consideration journey with gene therapy. And also to help you kind of formulate the conversation with your healthcare providers. So, we're here today, thrilled to be here, and thank you for having us. Before I step down, I do want to introduce Dr. Nina, who is the Director of TOVA Community Health, and I'm going to bring her up here next as our next speaker. So thank you all. I look forward to seeing you today.
Welcome everyone for coming out today on a Saturday where you could be somewhere else. I want to thank you for coming, and all of you who have worked with me in the past know I'm always thinking and doing projects and visualizing opportunities to really share with the community some of the groundbreaking research that is going on that has improved the quality of lives of individuals with sickle cell. And this transformative curative gene transplant treatment for sickle cell is something very dear to my heart. I have been working with the sickle cell community for over 2 decades and started out where there were no treatment options, but just to provide supportive care and comfort to those who were ailing. And to be here within the last 5 years to have 3 to 4 disease-modifying therapies that we can offer patients now is truly remarkable. But what is more important to me is the sacrifice of those who have suffered decades with a grueling, complex chronic condition that live in pain every day of their lives. They do their best to live the best quality of life they can. And when all of these disease-modifying therapies aren't working for them, and they're spending months and months back and forth in the hospital, they're looking for something else. And I had the opportunity to come upon a person who did just that. Tesha Samuel is a true sickle cell warrior. She was the 4th individual in the country to take part of the NIH trial gene therapy curative treatment, where she had one of 50 people to take a leap of faith. She knew what the risks were. She knew she could possibly die from sickle cell or the complications from the gene therapy. But from her sacrifice and dedication, she is making a way for those who are coming behind to have the opportunity to be cured of her sickle cell disease. I called her and I said, I want you to come to Delaware. She was like, sure, I'd be happy to come. And without any hesitation, I called her last night. She said, Dr. Nina, I promise I'm not gonna let you down. She said, my train leaves at 1 a.m. I will be here. So think about someone who cares enough to come to Delaware to share her story, her lived experience with living with sickle cell. This could never be possible without any sponsor support. Sharia actually came to my office and did a wonderful presentation about a month ago, and we said we have to do an event to really celebrate Tesha, and thank you so much for sharing Tesha's information. So without Bluebird Bio support today, Delaware Business Time, I want to thank, because we also have a special person in the house today, Dr. Rombell, who's actually in the lab modifying the cells to give back to patients so that they can be cured and not make sickle hemoglobin anymore. So I'm excited to hear what you have to say. But also the We Love You Foundation, who came in yesterday to help us set up the space. Readers Cafe, please get a box lunch for those who came in later. IFP for providing the photography and video support. And also Apple Market, who did some phenomenal job with the coordination today. The event planner, this is just spectacular. So we're in for a treat. So we wanted to bring up the stage to you. I want you to please stand and welcome Tesha Samuels, our sickle cell warrior, the 4th person in the nation to be cured of a sickle cell disease with a gene therapy clinical trial. Thank you all. Anything you want to say before we get started?
Yeah, first and foremost, I just want to say again, thank you all for being here. I really do appreciate opportunities like that to speak to, like this, to speak to communities like yourself, to really give my lived experience, because it's very different from a clinical experience. But when you're able to really share the trials prior to the experience during and what life is like now, I really call it a privilege. And that's why when Dr. Nina called me, I said, absolutely, I'll be there. So thank you all for being here today.
Thank you. Can you hear me?
My mic is
My mic is on.
Not really on.
Yeah, it's on. It's in the
Well,
on.
the volume is here.
Can you hear?
Now.
It's going in
Okay,
and
it's in and
out.
out, but you're speaking in a tone
Yeah.
that we can
Okay.
hear, both of you.
Okay, well, speak loud.
Yeah.
Were you able to pick it up?
Because if I'm honest,
A little closer.
I want to have a conversation.
Yes.
Right? So this can kind of get in the way. So I'll try and speak. Can you all hear me?
Yes.
Okay.
Perfect.
Perfect. So I want to get going. All right, Mrs. Tesha. What was your experience growing up living with sickle cell disease and accessing specialty care or a team of doctors who had a true interest in treating sickle cell patients?
Very interesting question, because there really was not a team of doctors for me. I'm 42 years old, and so 40 years ago, even 42 years ago, there really was no such thing as a team. You really didn't find doctors, practitioners that were really interested in sickle cell. So there really was a lack thereof. I would say I did eventually see a hematologist around the age of 13. And then from that point on, but they were not specialists in sickle cell, and that's the difference. So I was a patient, but I was not given the opportunity to really express or feel heard about my concerns about pain, about chronic fatigue, and things of that nature. So I did not have a team of physicians probably until my adult years.
Wow. So did you just see your primary care provider?
I saw my sure. I saw. Can you hear me?
Yeah.
Can you hear me? I saw a primary care physician all the way through pediatrics. At around 1920 is when I went into, or 21, I started the transition into adult care, and that's when I started to see a hematologist. But again, he was a hematologist, oncologist, but his primary focus was those with cancers.
Thank you so much. And having experience working with a hematology oncologist specialist, most of their interest is in serving the children or adults with oncology or cancers.
Absolutely.
They're not interested in benign hematological disorders. Can you talk about that, how that made you feel?
Absolutely. It makes you feel even more secluded than you already feel in your home. When you are in your home, in your school environments, your job environments, you already feel like an outsider. But to walk into a clinic, let's say, and you're going to the hemoc clinic, knowing that physician really is interested in those with cancer. And so it was a very lonely place at times when you're there for your blood transfusions and you're next to a patient who may have leukemia. However, they're saying they're in pain, I'm in pain, but the nurse goes to the patient to the left. So it was very disheartening.
Thank you so much for that. You had a stroke at the age of 13, and you had to go on monthly chronic transfusions, which you did and dedicated 23 years of doing that. That's 1 to 2 days of your life, 6 hours each month at least, were spent in the hospital to get blood transfusions to suppress your sickle hemoglobin level. But even with those, you still had sickle cell flare-ups and complications. What was that experience like?
To be honest, when I started the transfusion therapy at 13, I don't think I even saw the long term. It was just something that I needed to do to thrive. If I wanted to continue trying to be the 13, 14, etc., I needed to get these blood transfusions because I knew my hemoglobin, my sickle cell was, flaring up pretty frequently. And so not having the the insight to know that it will go on for 23 years. I didn't know how to feel at that time, but to continue to take 1 to 2 days out of your life, to sit there and get that specialized care, just to have enough energy to do some of the other things that you want to do, it takes a big bite of your life. And we start to calculate that time. I spent a lot of time just in that aspect alone. And so it was very challenging, but I tried to remain hopeful that there was something on the other side of this. So I could see, I did have enough insight to know there's something greater coming. Couldn't tell you what then, but I just felt that life can't be this hard.
I also wanted to talk. I was a pediatric nurse, and I had to stick those little babies, put IVs in them, so they could get relief of their pain. And I remember that sometimes if I couldn't get it in once, I had to do it again. I had to hold them down just to get the IVs in. And as you become adults, it becomes worse because your it's harder because your veins collapse. There's infiltrates that happen, complications from that. How did you deal with that with the chronic transfusions?
So once we went on the chronic transfusions, I would say within that year or so, they decided to put the line in. So I had a line placed in. Yes. So they started out with a line. I was still pretty young. So at that time, they didn't put the port in right then and there, but they did start an IV line. But by 15, I had the port. Since then, I still can't find a good thing. So if you are a phlebotomist, don't come looking this way unless you want a challenge. But I still had my port. And that port was really a godsend for me because it gave me the ability to not be Tesha the pincushion. Because who wants to go into, you're already in pain and then you become the pincushion, or you feel like you're the pincushion because they can't get a vein. And so this has been a godsend.
So, at what age did you transition to adult care? So you did find a hematologist,
I did.
but they weren't really interested in taking care of sickle cell patients or the sickle cell population. So when we talk about bridging the gap to adult care, what was your experience like? And if you go to TOVA Talk, one of the things that you stated to me, which was very profound, was that you felt like you were left in the wilderness. Can you talk about that?
Yeah, absolutely. The wilderness would be, there's of course a myriad of doctors. You go to your healthcare team and they tell you, okay, they give you, or even your provider, whether you're with Aetna, whoever your plan provider is, and they give you this list of doctors. That's like a forest to me. So what do they do? What do they specialize in? How can they help me? Will they understand my treatment plan or lack thereof? Will they help create one for me? And it left me as a patient and as my own advocate out there in this wilderness to figure out, how do I get a plan of care that makes sense for me? How do I get this new physician to listen to me? Because I know myself better than you do. I understand you went to school. A lot of it. I get that. But how does it help me? How does that translate for me? And so I really felt like alone in a wilderness with all of these tall trees in the darkness, trying to find a flashlight.
Oh, wow. So, excitingly, there are new sickle cell treatments that started to emerge, like hydroxyurea. We have Oxbryta, Voxelotor, we have Adakveo. But maybe these disease-modifying therapies don't work for everyone. And at what point did you say, I had enough? I am willing to take a leap of faith to explore any new treatment options, any new clinical trials, even if there is some small or large risk involved.
It was a staged process for me. I think the first light bulb went off for me when I was 27 years old, met the love of my life, wanted to get married. And every young woman dreams of this day of wearing whatever that dream dress is for you. Where mine was this white, long, beautiful gown. And I wanted my eyes to match the spirit within my heart and the whiteness of my gown. And when I went to my hematologist oncologist and says, please, is there something you can do to make, I mean, if it's just for that day, I just want my eyes to be pristine. And for her to have this despair in her eyes, like, there's nothing that I can do about that, you know, that is caused by your liver. And, you know, all of the technical things, that none of that I want to hear at that moment. I just wanted to hear how I could match my dress with the eyes. And so that was the first process that said, I'm just so tired. I was tired. And that tiredness went into weariness and despair. And then because of the monthly transfusions that I had been on since 13, my iron level or ferritin level was extremely high. And so at that point, I was then not only doing the monthly blood transfusions, but was getting iron chelation medications once a month as well. So that was more time in my schedule that I had to budget in to not be the normal adult that I wanted to be. And when I went to my doctor this particular visit, and she pulled me in for that 3-month checkup and says, Tesha, your iron level, your ferritin level is so high. We're afraid that you're going to have some liver damage, some kidney failure. I don't know what else to do for you. And when your doctor looks at you and says, there's nothing I can do for you, or that I'm not going to try and figure something out with you or for you, I knew then there has to be a better way. I needed a better quality of life. I was tired and I was desperate was the word. I was desperate. And so that desperation led me to continue to be my own advocate. I searched online and NIH had this trial. And so that desperation and faith, the two married together to get me to that place.
So I just want to recap on this. It wasn't your hematologist oncologist that shared with you there's an opportunity for a clinical trial. You actually did your own research, your own searching.
That's correct.
So talk about that.
Again, another wilderness and wanting a different outcome, not taking no for an answer. I can take a not yet, but not a no. And again, wanting to have a better quality of life. I saw different things in my future that maybe no one else saw. But I was determined to go forward and find that. And again, not taking no for an answer. I knew that NIH had a trial where, you know, there was a half-sibling match. You know, for many, many years, that's where we were kind of left at. If you have a half-sibling, you could do a bone marrow transplant, and that was that. And I think, you know, between timing, God's timing, however you want to classify that, and me looking and being desperate, it got together. And that particular time I made that call to NIH, they said, hey, we do actually have a treatment where you can use your own stem cells. And right then and there, I said, this is it. This is it.
So you arrived at the National Institute of Health. How did the transplant team describe the risk from the procedure of the gene therapy curative transplant? This includes taking a chemo drug called busulfan and the possibility of developing cancer or dying from the gene therapy transplant. Can you talk about that?
Yeah, first I want to segment it out because this was in 2018, and so the risk of cancer didn't come until maybe 2 years or so after I had completed the gene therapy trial. What they were able to alleviate, really talk to me about was the vector, the viral vector that was used in order to do the gene therapy, which when they tell you that even though it's a deactivated version of HIV, you hear HIV and you say, whoa. Well, I said, whoa. And so that was a real moment for me. But they were able to articulate enough to me to make me feel confident that, okay, they would never give me something that's going to harm me intentionally. So that was the first part that they had to break down for me. And then the second thing was really having to explain the amount of time that I would spend in the hospital, That scared me because again, you've been out of, I've been maybe a month out of work for a moment for a crisis. I'm sorry that I'm getting emotional. Just kind of reliving this. It's so real, even though it's 6 years ago, it's fresh. And so, hearing all of the risk, they did adequately tell me about the busulfan that I would experience, not being able to maybe talk or, maybe not even want to eat because of the irritation that it will cause. But it still, to me, was like, okay, I don't know how I would feel with this, but I know what I've been feeling for 35 years of sickle cell. And is it worth the risk? For me, yes. The answer was yes.
So I want to say here that I worked on, or at least developed, a sleep study research trial where patients just have to wear a watch for 7 days to track their sleep patterns. And even with that informed consent document, it's about 6 pages. It's not going to harm them. And they do get compensated for their time. I am sure that that informed consent was at least about 10 to 15 pages long. How do you recommend information like this to be disseminated to patients in the most sensitive manner?
I think coming to the table, understanding that people learn in different ways. So some are auditory learners, some prefer to read it at their own leisure and really intake the information. Others want it visually. I really think for something that will change your life so dramatically throughout the process and then thereafter, there needs to be an approach where all three, at some level throughout the entire process, that you are bringing all 3 types of learning, because it is a lot of information to take in when you go to sit down and do this informed consent. You are exactly correct. It might have been maybe 15 pages, front and back. You can't take that in. But what my family and I did do, first of all, whoever that family is, whether it's the familial bond through blood or it's the one that you have created, take someone with you, because you're so focused as the warrior on this could potentially change my life that you may miss some points, some very, very distinct points that will that you may just glaze over. But having them, my husband, my mother, are taking notes, asking the questions that I may have forgotten. So I think that's a part of it too, and bringing in your community, whatever that looks like for you, and having them be a part of that consent.
So you were saying that when you went to your appointments at the NIH initially, and your PI, which is your principal investigator, sat down with you to review the informed consent, did you have your family or support person available with you to ask questions on your behalf?
I absolutely did. Everyone knew at NIH, Tesha didn't come alone. I would always have probably like 6 people deep. Because what one caught, the other one didn't. And so they knew from that informed consent, oh wow, she's coming with a clan. And so yes, we went as a family, and all of them got their questions answered, because they too are very pivotal in, this transition for us. And so yes, they were very much aware and very involved.
So I imagine you probably had mixed emotions at a time where you probably got a little cold feet. But I want to step back again, because when we had our TOVA talk, you shared something very poignant to me. The longest amount of time you spent in the hospital from a sickle cell complication was 6 months. How did that hospitalization impact your quality of life and you to say, I'm ready to move forward?
I was 16 at that point, and I had a acute chest syndrome. And the pain was so bad that they decided to put me in an induced coma. And waking up, a few months, about a month, I was in that induced coma, and having to learn how to walk again, how to bathe myself, how to do all of those things that at 16 you're so willing and wanting to be independent, and now having to fully rely on your caregiver. That process for me, I went from a wheelchair to a walker, to a cane, literally having to do this step by step. And at 16, when you're looking at Sweet 16, you're trying to date, you're trying to figure out life as what you think is, a young adult. And I was already being homeschooled. So that for me, taking that social life away, and then at 16 being in a hospital I was in the hospital for 2 months, and then for 4 months at a rehab center, trying to regain that strength back. And so quality of life for a 16-year-old, you couldn't tell me I didn't have that. It was doctors and nurses became friends and family at that point.
So I want to just say this because there's studies by Dr. Wally Smith that show that at least 30% of adults with sickle cell live with pain every day of their lives. And even though the hematologist was able to suppress your hemoglobin S down to less than 30%, you were still having sickle cell flare-ups. And you were living with pain every day of your life. And they probably were saying, well, how can you be in pain? How can you have these problems when you don't even make a lot of sickle cells? We're transfusing you every month with non-sickle cells, but yet you had a lot of complications regardless of that.
Yeah. One thing I would say about the sickle cell community is we are resilient. I can't tell you the amount of times that I've heard the negativity. I remember being in the hospital and they were doing grand rounds, and I could hear them talking outside the door and says, she has to be making this up. She's on enough opioids to kill a horse. And you're outside of my door. I've had nurses come to bedside and say, I really shouldn't be giving you this medication. How about I decrease this dose and not tell anyone? And so you're warring with your body because you really don't have enough strength to fight, but you're still having to fight the people that's on the outside that are there to supposedly help you. And so I can't stress enough how important it is to be your own advocate or have someone there to advocate for you, because it is extremely difficult to really go into these ER settings and these clinic settings and be able to get the care that you deserve, to combat the stigma that is associated with African Americans coming in. You're already taking a high dosage of opiate medication, and they're thinking that you're having drug-seeking behavior. Having to feel like I got to put a suit on to go to the ER because otherwise I'm not believed. So all of those things you are combating with, and it begins to weigh on your psyche eventually. And it's almost like, do I give up or do I keep fighting?
Are you an author yet? Or you want to tell your story? Because I think it's so important to really share, You just really encouraged me to continue to press on and also assist in just helping to bring awareness as well. So when is your book coming out?
This space for me right now is, I hate to say it, but imposter syndrome, because it's so hard for me to believe that when I think back, and it's such a memory that I can pull, and that's why I get so emotional, because I know how much time I spent praying and crying for what I feel right now. And so just finding the time and space, and you're not the first person that asked me, and I think that's going to make me go home and encourage me, because I have journals that I could probably publish tomorrow. So thank you for that encouragement, and I'll be the first. I'm going to reach out to you first as soon as it's published.
I want to be the first one to purchase it.
And I'll make sure I sign
Besides
it. Thank you so much for that encouragement. I appreciate it.
More questions? Thank you.
Is this treatment available to patients outside of the United States?
Jerry, you might have to answer that.
Yep, all right. So first and foremost, all right, I hopefully you guys can hear me. First and foremost, I'm not a physician, and so I have to disclose that, right? But I am here representing Bluebird Bio, and we do have one of the 2 gene therapies for sickle cell disease, in fact, gene addition. Also for fair balance and compliance, usually we actually have a presentation and then followed by questions, but I'm going to do my best to stay in compliance. So to answer your question specifically, currently our product was approved by the FDA back in December of 2023, and therefore it is available in the commercial market here in the United States only. Unfortunately, we are not available overseas at this time.
Thank you. More questions?
I have two questions for you, but the first one is, how do you feel?
Ooh, that's a loaded question too. How do I feel? To sum all the emotions that just came into mind, really blessed. I'm excited for what this opportunity is given to many patients, just not in the sickle cell community, but as Sherry could probably, it's groundbreaking. So there are other illnesses that could actually benefit from what we've done back, 6-7 years ago. So I'm encouraged. I'm encouraged that people like you are coming to events like this to really become knowledgeable, right? We got to keep sickle cell and be advocates in a way of knowing really what sickle cell is, because what you'll find is people aren't speaking up about it, but the minute you mention it, they remember, oh, I had a classmate, oh, I have a family member. So I'm encouraged, I'm inspired by the battle that all of my other warriors are going through, and through their caregivers who are championing them, carrying them on their backs. I could go, the list could go on and on, but to be honest, I just feel, I'm grateful and I feel painless.
My second question was, I know you took a train here, but have you been on a flight since you've been, I'd like to say, cured?
You can say cured. For me, I'll say cured. So I like to say I stay busy booking the next flight, because I wanna explore the world. Cruises too, being out on the water. So yes, I have taken a flight. Not long. I try not to do long flights. I haven't really gone across the country yet, but I'm willing to do it now.
That's good. And it feels all right when you're up there.
It feels fine. Yes, ma'am.
Awesome. Great. Thank you so much.
No, thank you for the question.
More questions?
What does your care look like? You have a care team that follows after you said quarterly. So what is that experience like now since you've had the treatment?
Great question. So immediately after the gene therapy, they put it in intervals. So it's every month, then it goes to every quarter. I'm at the point now that I'm every 6 months. What that looks like at the NIH, I'm still equipped with the team that led me through the process, meaning the principal investigator, the physician, he's a hematologist, a sickle cell specialist. If I need it, I have support, mental health support there if I want. And then they're doing just testing. So everything from an MRI and an MRA down to bone scans. So that's what that looks like. However, now that I'm living in North Carolina, I'm in the process of finding care closer to home. But even that is still a distance. I'm still having to travel about an hour and a half to find a sickle cell team that can even help me make that transition from gene therapy so you don't have sickle cell per se, but you're still you need some additional support. And so I'm in that process of finding some care closer to home, because not everyone is equipped. And that's a problem too. Not every hematologist is equipped to really help you through that transition.
Thank you.
Thank you.
You mentioned that it you took a train ride to get here today. Do you have any sponsorship or any support to help you to do things such as what you did today, to come and to share your testimony and just the platform for the whole experience that you had with the NIH?
Great question. So it depends on the event. So yes, I do, through sponsorships
get to places like this, one of the things that I always want to be careful of, I don't really do it for that, even though it is a cost associated with it. And I of course weigh that against, some of the responsibilities, financial responsibilities my husband and I have. But it really is my passion to do this. I wish I could do it full time, but until I get to that point, I'll do what I can, when I can, and how I can. So I hope that answers your question, but yes, most times it is sponsored.
And going through the process, one of my questions was, going through the process of what you went through, is there anything that you would like to see done differently?
I think I touched on it a little bit. I think that using or knowing what we know about how people learn, knowing that the sickle cell community come from most times those who may live beyond the poverty line, which means that education may not be, they may be living at a 5th grade reading level. You cannot stick a 15-page document in front of them and expect them to understand what they're really signing up for. Please don't get me wrong, it was a hard decision. And I say I led with my desperation and my faith, but it is still a hard, and being able to be on the other side of it. But there were days that you like, what did I sign up for? And so knowing full well what you're going into, and having your family or your community support knowing full well what they should expect is important. So making sure that the materials are readable, understandable, relatable. Even if it takes warriors like myself that have gone through it to say at a certain point, a little short video, you got this. This is what maybe you can expect later. So I'm thinking of, really innovative tools. Meet us where we are, whether it's an app, whether it's, a video, a YouTube channel specifically for that. Let's dial in. Let's get everything kind of molding together so that people feel like they can really understand the process.
Do you still experience any, let's say, residual pain, or, I know you say you take Tylenol and those kinds of things, but like every so often do you maybe get like a twitch and it's like, what was that?
Absolutely. Every now and then, especially in my back and my legs, because that was usually those pain points for me when I would go through crisis. So I do have back spasms. Usually what I'm learning is relearning my body, what brings that on, and usually a lot of stress, because stress is something that would trigger a sickle cell crisis or change of weather. So I'm still a little, I still try and push, but then not push too much, because then when I start to feel that little something is different, when I'm feeling a little pain here, I kind of look at what have I done in the last couple days or couple hours that's triggering this pain. And then residual, one of the things, because I've had a stroke, several TIAs, my short-term memory has been affected. It was always affected, but now I find that really, I don't know if it's because I'm getting older too, that could be definitely a part of it, but my memory isn't what it used to be. And so I'm watching that, I'm keeping an eye on that as well, but that's a residual effect for me.
Well, I actually have two questions. So I wanted to know how your perspective has changed on health and wellness since you've been cured.
I think my perspective changed because initially with sickle cell, you're just trying to make it through the day. So it was more about surviving. Now my perspective is I've gotten an opportunity that most may or may not ever experience. How do I make the most of it? And how do I begin to thrive? So making sure that things that I really didn't think about, like diet, I didn't think about that. Exercise, I was inconsistent. So now that I have this opportunity, I'm feeling like it's Invasion of the Body Snatchers. Like, whose body is this? So really learning it, taking the time to learn it, and figuring out what's best so that I can keep the momentum going. And so that's how my perspective has changed.
Okay, thank you. And my next question was, What has been the most significant thing that's changed in your daily life since you've been cured?
Yeah, the release of the pain and fatigue, because when I think back now, that is really what suppresses you. You know, I really didn't feel like, I feel like I'm really getting to know Tesha. I'm silly, I'm, quirky, I'm all of these things, and I'm like, I don't remember this, because if I wasn't in pain, it was because of the medication, and the side effects of the medication kind of make you, really suppressed, and, so, and then you're sleeping. So it was this never-ending cycle. So definitely the release of the pain and the fatigue and feeling like I have so much more energy. How do I expend that energy in a way that's productive for myself and for those I care about?
Gosh, thank you so much. So I'm Irene Rombell, and you are so inspirational. You are the reason that I became a scientist. I decided to become a scientist when I was 12. I got my PhD over 30 years ago, working on actually my PhD postdocs. All my research was on gene regulation, gene expression, including on globin genes. And my goal my whole life was to help patients ultimately, and I'm like, oh my gosh, you are so inspiring, because it's taken so many decades and so many thousands of scientists around the world to get from cool science in the lab to a curative therapy, and it is truly curative. It's a one and done therapy when you use these gene modified cell therapies or the pure gene therapies. For me, it's miraculous, and the amazing thing is they can cure the diseases that no other traditional medicines can treat, like small molecules, antibodies can't address these genetic diseases. So to me, it's miraculous. And I love the quote that you have on your, it's in mine. I've made so many pages of notes, so I think I wrote down everything that you said. There's a beautiful quote that you have about, with God, the seemingly impossible becomes possible, because I think that's so important, and that's, to me, God works through scientists and through physicians, and this is really inspiring. Actually, so 3 years ago, I did the crazy thing. I left a safe job I used to be first at J&J and then at Spark Therapeutics, which had the first FDA-approved gene therapy, and I decided to be a pioneer and start my own company to develop actually, it's an AI-based technology that applies to hopefully all or most cell and gene therapies. So I'm hopefully going to be able to help people, so many ultimately like yourself, because that's my goal. It's crazy. I mean, this morning I was up, 5 o'clock working on my slide deck, making slides with the cost of gene therapies, because my goal is to make them faster and cheaper, and because these prices are not tenable for anybody, not for the healthcare system, certainly not for patients. And so that's my goal, is to, how do we bring that cost down by orders of magnitude, not just a little bit, because that's really, then it goes from being just a very cool therapy to something that truly helps a lot of patients. So thank you. I can't thank you enough, because sometimes it's really hard day after day working on something when you think you're a little bit crazy and a pioneer, and then I meet you and I'm like, oh my gosh, it's all worthwhile. So thank you.
No, thank you. I'm tearing up because seeing you makes this a full circle moment. Because for many years, as I mentioned, you feel like you are the forgotten disease, the forgotten patient, and to hear a scientist say that at 12, you knew that that's what you wanted to do, is to help patients. And I think many more patients like me need to know that there are people like you that care, that you are working, and I think it's a mutually beneficial relationship for you to see us and us to see you, because we want to inspire you to keep going so that it is more cost effective. I said that was one of my fears, is that we can't get this to many more warriors because of the cost. So I just want to thank you for being here. Thank you for listening to my story. Thank you for the many nights that you probably poured over a microscope or, white papers or whatever it took to get us to this point. So thank you, Dr. Ramel, truly.
Absolutely. So first and foremost, stop by the table today because I have plenty of resources and brochures for everyone to take away. The very first thing you can do is you can certainly go to our website, which is liftginia.com. That site has, and if you don't know how to spell it or want to write it down, stop by the table. I've got some postcards that have a QR code that you can actually get right to it. So, but anyway, that site has a wealth of information, not only on the product, our product specifically, but also this wonderful patient consideration brochure, which has a wealth of information about the actual product, the study, lentiviral vectors, and the correlation to that in terms of the treatment. And then lastly, there's some great 2 pages in the back to kind of help warriors and their families formulate a conversation with their healthcare team. Because as I said earlier, this is not a conversation, but many conversations. So there are some guides here to kind of help you, think about all the questions, or at least start some of the questions that you might have for your healthcare team. So that we have that in the back as well, and as well as available on liftginia.com. Also, we have a patient navigation team, which is called My Bluebird Support. In the back at our table, I have a postcard as well with the QR code, and you can go to that website, which is mybluebirdsupport.com. This is a team of patient navigators. They're specialists, I like to say. Many of them were or are nurse practitioners who have treated in the sickle cell space. And this is a team that can talk with patients, families, warriors, one-to-one about their specific situation. So things like, will my insurance cover this? Where can I find a treatment center? And by the way, you can also go to our website. There's what we call a QTC, which stands for Qualified Treatment Center, locator on our site as well. But going back to our patient navigation team at My Bluebird Support, they can definitely talk with you one-on-one and answer all of these questions, again, specific to you. Also, other ancillary resources such as, fertility preservation assistance, transportation assistance, as you are trying to formulate and put all this consideration as you're considering, gene therapy for yourself. I do want to say you don't need to have decided that you're moving forward with gene therapy or even our gene therapy to connect with My Bluebird Support. If you are just beginning the journey and wondering, is this for me? Where do I even start? I don't even have a provider that I can talk to. Connect with them. There's no obligation, and they can kind of help you navigate all of that. So again, those resources are available in the back of the table. Stop by. I'm more than happy to share any or all of that with you all. And yeah, just let me know how I can help. Thanks.
Thank you all.
I'm going to have
The Shabaki.